Okay, I'm Shannon Weber with Hive, a hub of positive sexual and reproductive health. And it's April 2015. We're here in Oakland, California. Do you want to introduce yourself?
Sure. So I'm Liz Brosnan Johnson. I'm Executive Director of Christie's Place, located in San Diego, California.
And we're going to talk a little bit today about this really pioneering work that you've done with hiring peer navigators at your program. So first, give me an idea of the setting. What is Christie's Place and what do you guys do?
Sure. So Christie's Place is situated within a health equity and social justice framework, and we provide gender-responsive and trauma-informed behavioral health care, social services, basic needs assistance, and advocacy to women, children, and families impacted by HIV and AIDS.
And this is in San Diego?
This is located in San Diego. We actually operate out of a house, and we're in a residential and commercially zoned neighborhood, so it's very nondescript. There's a lot of anonymity and safety in our location. We really try to be a one-stop shop for a lot of women and families that we serve. So located, we have food resources, we have clothing, hygiene products, we have on-site childcare, mental health counseling, case management, and also we offer a lot of peer services.
And just also to give a sense and a flavor of more of your program, how many clients or women or families do you serve in a year, and how big is your staff?
Yeah, so we serve about 1,200 clients a year. So around 400 to 500 families is what that ends up looking like. Yeah, so we serve anywhere from 300 to 400 HIV positive women a year. We also have some positive children that access services at Christie's Place. Our staffing, we have about 21 staff right now, and we also have a social work intern. We have an MSW intern every year as well.
We have some very exciting game that's going on
here
at the same
time. I think they're excited about Christie's Place.
They may be. They're like peer navigators.
That's right, yeah.
When did you first hire peer navigators?
Well, we actually were founded with a peer model. So back in April of 1996, we were founded completely volunteer, grassroots, mom and pop nonprofit, and we were founded with peers. We got our first grant, our government funding, in 2002 through Ryan White, Part A, and that's when we were able to hire many of the fabulous volunteers who've worked at Christie's Place pro bono. So, but we actually looked at our peer model and really revamped it. And made it a lot more, not just about the one-on-one emotional support and peer-based counseling and health education, but really ramped it up to healthcare systems navigation in 2010. And that's when we made the transition from peer advocacy to actually employing peer health navigators.
And did you do this, because I know you've really played a pioneering role around being responsive to ACA rolling out. Was that part of your vision related to that? Or
in a way,
just
Shannon,
didn't line up?
It was kind of the perfect storm. We became aware of a really alarming statistic in San Diego where 69% of HIV positive women had unmet need, or they were out of care for 12 months or longer.
Oh, wow.
And so that was really devastating to us because we were doing a really good job of keeping women who were engaged at Christie's Place linked and retained in care, but we were not reaching more than 2/3 of women in our region who were living with HIV, who were living in isolation. And so what we needed to do was take a look at our model, and at the same time that was happening, we also had the changing landscape where really ACA became an opportunity for us to be able to better serve women. And so that's sort of where the navigation model came from. And so based on a community need and, the changing environment, we were able to create this program. And also, really thanks to a funder, AIDS United, who took a really smart, calculated risk in funding us because we, at that time, were, and we still are in many ways, a very small women-run AIDS service organization. And so they took a risk, and we got some funding through their Access to Care initiative, and then we're able to expand the program with social innovation funding as well. And now we also were able to get some Ryan White funding through the Part A program because our county has seen that this is definitely an effective, cost-effective, and also effective in terms of improving health outcomes for the women that we serve. And so they've enrolled some of this into the Ryan White funding as well.
Oh, wow. So what do you think are some best practices or lessons learned that you would share? Because you're very passionate about peer navigation, and you can hear from other programs who've either tried it or attempted it at some points that it was challenging for them for a variety of reasons, and you have a really positive response to it. So tell me about that, best practices and lessons learned.
Yeah, we've learned a lot of lessons over the years. And I think the first piece for us back in 2005, 2006 was that we really needed to have a strong clinical supervision model. So, we really believe in the peer model as really the cornerstone of our service delivery. I think we could probably take everything else away. The peer piece is really the most critical. We have seen tremendous success from that program. So the clinical supervision piece was really important. Also making sure that our policies were flexible. I mean, not too flexible, but flexible in terms of the work environment. We also had to do a lot of education with our clinical partners, and I think we kind of jumped the gun. We had these peer navigators, and we were expecting the clinics to welcome them with open arms, and we had to kind of take a step back and do some education and really kind of explain to the clinicians that our peers are trained. They're closely supervised. They're not giving advice that they shouldn't give. They're really clear about what their role is and what their scope or purview can be. And so doing some of that education ahead of time really helps her sort of build a relationship.
What was the time frame for that? So if I'm at a CBO and I'm thinking, oh my gosh, this feels like a next step I would want to take. I mean, was that a 6-month process, a 2-year process, and never ending? I mean, in some ways it's never ending, but like, what was it until you felt like you had some competency around it and that it was respected amongst the clinics you collaborate with?
I think internally for us to have some competency, it was around 6 to 8 months, and then another 6 to 8 months for the external stakeholders to really kind of buy into the model. So I think it can take up to 18 months to have a successful program, but I do think it's dollars well invested. We've seen a lot of return on that. The clinical partners, we have some primary care providers at UCSD that have told us, I don't want to see a woman unless she's hooked up with a peer navigator. So we've had some really tremendous success in helping women get to zero, reach viral load suppression with that service.
Beautiful. Do you guys do training or capacity building around this if someone was interested?
We actually do. So we're actually a partner. AIDS United has their Getting to Zero campaign or technical assistance capacity building that's funded through the CDC, and one of those is around peer navigation and patient navigation. And we've actually provided some technical assistance. So providers out there have CDC funding. They can go to AIDS United, fill out the CRIST request, and we're one of the TA
amazing.
Consultants for peer and patient navigation through that program.
Awesome.
And then folks can also just contact Christie's Place. We've done a lot of, I'm also the chair of the National Women and AIDS Collective, and so we've done a lot of webinars, sort of e-learning around employing this model. And so folks can also check out HIVEonline.org website for information, or can just look me up at Christie's Place, and I'd be happy to talk to them about some opportunities.
Awesome. I want to thank you for all that you do.
Thank
I mean,
you.
you've been such a leader and had such a vision around so many of these complex issues that small organizations serving women have faced, and have really, I feel, triumphed. And thank you so much.
Well, we have fantastic staff, and we really have some of the best peer navigators out there. So
I love this. I have to come do a visit and make films with them. All right, thank you so much.
Yes, that'd be great.
Awesome.
Okay, thanks. Thank you.